swollen legs, ankles, and feet. For some people, it is a minor annoyance, while for others, it is a persistent condition. How did this condition come to affect such a large number of people? In this video, we will investigate the mysteries that surround leg swelling and reveal natural solutions that can be found in unexpected places. To begin, just what is the exact cause of the swelling? That depends. First, though, I kindly ask you to like the video and subscribe to this channel. It is very important for us. Thank you very much. Some of the causes of temporary swelling include standing for an extended period of time or engaging in strenuous physical activity. The reasons behind this are easy to see. Long-term swelling, on the other hand, suggests that there is a more underlying problem. In addition to the liver, heart, and kidneys, other organs and tissues can also be affected by pooling fluids. Even deficiencies in particular vitamins can be a factor in the development of the problem. The image that comes to mind when we think of swelling is that of an accumulation in the tissues. Because of the excessive amount of fluid, the skin and muscles expand, much like a sponge that is soaking up water. Due to the fact that gravity pulls the fluid downward, the legs and feet are the areas that are most affected. The question is, however, what kind of fluids are these? Plasma, which is a transparent, yellowish liquid that accounts for 65% of blood, is the primary offender. Blood cells and nutrients are transported through the veins by plasma, which also removes waste from the body. At the same time, however, when there are issues with the organs that filter plasma, such as the kidneys and the liver, it is not possible to remove it adequately. It is possible for the excess plasma to leak out of the blood vessels and into the tissues that are nearby. Swelling is the consequence of this. It is also possible that lymph, which is the fluid that travels through the lymphatic system, contributed to the problem. Although it functions independently, the lymphatic system is highly similar to the circulatory system of the blood. White blood cells are transported by it, and it also intercepts bacteria, viruses, and other agents that cause disease. The lymph is filtered by lymph nodes, but a backup can occur when there is a blockage in the lymph nodes or vessels. After that, lymph begins to leak out into the tissues, which ultimately results in swelling. It appears that the swollen legs are the result of an excess of plasma and lymph. On the other hand, why do they accumulate in the first place? In its most basic form, swelling is caused by a malfunction or imbalance in the body of some kind. Let us take a closer look at some of the most important factors. Heart disease. The heart is responsible for pumping blood through the circulatory system. In cases where the heart is damaged or weakened, it is possible for blood to pool in the veins of the legs, which then causes fluid to be expelled into the tissues. Liver disease. The liver removes waste products and toxins from the blood. It is possible for these to accumulate in the blood and cause leakage into the legs when it is damaged. Disease of the kidneys. When the kidneys are healthy, they remove waste and excess fluid from the blood and excrete them in the urine. It is possible for the fluid to remain in the bloodstream and eventually pool in the legs if the kidneys are not functioning properly. Clots in the veins of the legs are a type of blood clot that can obstruct the normal flow of blood. When the blood travels through different pathways, it frequently leaks plasma along the way. Medications. Certain medications, such as corticosteroids, antidepressants, hormone replacement therapy, and medications for high blood pressure, have the potential to cause sodium and fluid retention during treatment. Because fluids tend to move downward, they are not pumped back up in an effective manner. Deficiencies in vitamins. The accumulation of plasma and inflammation has been linked to deficiencies in certain vitamins. The organs are put under stress, and fluid retention is increased as a result. Obesity. Excess body fat, which is a characteristic of obesity, exerts pressure on the legs and abdomen, making it more difficult to pump fluids back up. As a consequence of the strained circulation, blood pools and plasma leaks out of the legs during the process. Pregnancy. In pregnancy, the uterus exerts pressure on veins, which results in the leakage of plasma into the tissues of the legs. Fluid retention is also affected by the fluctuating hormone levels that occur during pregnancy. Aging. As we get older, our organs begin to function less effectively, and our circulation begins to slow down. Body parts that are dependent on fluids, such as the legs and feet, are more likely to accumulate fluids. The list goes on. Variable causes include chronic diseases as well as factors related to lifestyle. However, the fundamentals are the same in every instance. When the organs and systems that regulate fluids are compromised, plasma and lymph accumulate, and then they seep out into the tissues. More complications arise as a result of swelling itself. Putting too much pressure on the skin can cause it to break down. As the heart works harder to pump more blood through the circulatory system, the accumulation of fluid puts strain on the heart. Blood clots can form as a result of immobility caused by swollen legs. Pain, heaviness, cramping, and other symptoms are present. Therefore, reducing the swelling is essential. However, is there a natural way to reduce the amount of swelling? Certainly. Take a look at some vitamins that might be of assistance. Thiamine, which is another name for vitamin B1, is a water-soluble vitamin that plays an important role. Fluids can accumulate around the heart when there is a deficiency in B1, which prevents the heart from pumping blood effectively. In addition to supporting the health of the liver, nerves, and kidneys, this vitamin is beneficial to the heart. Nutty foods, beans, seeds, seafood, and whole grains are the best sources of this nutrient. In addition to being water-soluble, vitamin C is a naturally occurring anti-inflammatory agent. It protects the body's blood vessels, bones, and organs. Through its support of the kidneys and circulatory system, vitamin C brings about a reduction in fluid accumulation and leakage. There are many excellent sources, including citrus fruits, berries, peppers, tomatoes, and leafy greens. Vitamin D, also known as the vitamin of sunshine, is essential for maintaining overall health. It helps the body absorb calcium, which is essential for bone strength, and it also reduces inflammation. The body is able to produce its own vitamin D when it is exposed to some sunlight. Also, a source of this essential vitamin are fatty fish, eggs, liver, and foods that have been fortified. Different herbs and spices, in addition to vitamins, have their own set of advantages. Kidney function and maintaining healthy fluid levels are both supported by dandelion. In order to reduce swelling, it functions as a natural diuretic. The nettle leaf has both anti-inflammatory and diuretic properties. When combined with a reduction in fluid retention, it improves circulation. Ginger is known to enhance circulation and blood flow, and it also possesses anti-inflammatory properties that can help reduce swelling. Additionally, fennel seed has the ability to reduce inflammation and acts as a diuretic. Garlic, pine bark, grapeseed extract, bromelain, and essential oils are just some of the natural remedies that can help reduce swelling and improve circulation. We have now discussed the factors that lead to swollen legs, as well as some possible natural remedies for the condition. When it comes to combating this condition, what other options are there? To facilitate the drainage of excess fluid, it is beneficial to lift the legs on a regular basis throughout the day. While lying down, even simple leg lifts can assist in the process of pumping fluids back up. Compression stockings exert pressure on the legs, increasing the amount of fluid that is pushed upward and enhancing circulation. Increasing blood flow and lymph drainage from the legs can be accomplished through movement and gentle exercise. During massage, circulation and the movement of fluid out of the tissues are both encouraged. Diuretics, also known as water pills, are medications that increase urination in order to reduce fluid retention. They offer some relief in the short term, but they do not address the underlying causes. During surgery, vein valves can be repaired, and lymph nodes can be removed to cut down on swelling. As a last resort, when all other options have been exhausted. Obviously, any underlying condition that is the cause of the swelling needs to be treated in the appropriate manner as well. Utilizing natural remedies in conjunction with conventional treatments, on the other hand, may offer the greatest potential for alleviating the symptoms of leg swelling. The correct treatment prevents the fluids from flowing in the correct manner and prevents the legs from becoming inflated like water balloons. If you liked the video, click the like button and subscribe to my channel. Thank you very much and see you next time.